Hey guys, how's it going? Welcome back to our channel. I hope you're having fun studying for your USMLEs. Um, let's take it up a notch. So today we'll be discussing strep, specifically Streptococcus pyogenes, also known as Group A strep, Group A strep. So let me start by giving a basic background on Group A strep. Um, as you know, it belongs to gram-positive cocci, which basically constitutes two major groups, which are really important for the exam. One is catalase positive, other one is catalase negative. And positive one goes into Staphylococcus, and so on and so forth. But our main concern is with catalase negative for today, and it constitutes a whole bunch of different kind of strep. We are just dealing with strep pyogenes, which is group A strep. All right, so I'll have to make another video to go into the rest of the classification because it's very detailed. But for today, let's just stick to strep pyogenes. All right, so coming on to strep pyogenes. Let me start by giving a bit of background on Streptococcus. So, like I just told, they are gram-positive. I'm talking about all strep now. So they are gram-positive, but lack your catalase. They occur in chains rather than in clusters. All right, and you can classify them based on either Landspeel's classification or based on the degree of hemolysis. And if we go by the degree of hemolysis, then ours would be so we basically divide them into beta for how much hemolysis depending, and beta hemolytic basically gives you complete, and then partial is alpha, and last is gamma hemolytic, which have no hemolysis. So ours is group A strep with beta hemolysis. That means it lyses completely the blood cells when cultured. So let's move on. Okay, there are a few virulence factors, which is basically what gives virulence to the bacteria, like what causes harm to you in simple terms. So for strep pyogenes, it's protein M, and then it has streptolysins, ONS, which are used in lab to test antibodies against these streptolysins, and so to figure out infection with Streptococcus pyogenes, and then they can produce streptokinase. They also produce a pyrogenic X toxin, which causes fever, and then they have a variety of destructive enzymes like DNase, hyaluronidase, and so on and so forth, and enzymes. All right, so let's rush to the diseases it causes. So it causes a host of diseases, and let's start with the most common, which is strep throat, also called pharyngitis. Pardon my writing. So strep throat is caused by direct invasion of the pharynx or tonsils. And then if you have seen patients with pharyngitis, they have red swollen tonsils and pharynx. They also have a purulent exudate. They might come in with a fever, and you diagnose them with a rapid antigen detection test, also called RADT, and you culture their throat. It's otter throat culture along with it. Treatment is with penicillin if not allergic. And then the second type is the skin infections it causes. So like strep also gives you skin infections by it gives it by direct invasion, and it's similar to staph. We'll talk about them again when we are dealing with staph. Third is scarlet fever, which is seen in children generally, and it's because of the pyrotoxin release we were talking about earlier. So the characteristic is the sandpaper rash, which you should remember for your step 1 exam. It starts at the trunk and head, and then spears the face. All right, so central to out. If we have a dude, from neck and trunk, and then it spreads out. All right. Next, okay, yeah, and the kid can also have a strawberry tongue in here. This will be strawberry tongue. Yeah, that's my drawing. So the next kind it leads to is your toxic shock syndrome, which is not a good thing. As the name implies, it gives you shock. That is, your BP drops to the point that you require vasopressor support. That's basically shock definition. So release of a pyogenic toxin is what causes toxic shock syndrome. It's similar to what staph causes. Then you have rheumatic fever, which is by itself new topic. Just remember it as the Jones criteria, where you have, I think, 2 major, 1 minor, or 1 major and 3 minor to make a rheumatic fever. I'll have to recheck that if they have or have not updated the guidelines. And then everything's given in that criteria. You'll have to go through that. We'll make probably another video on that. It's a huge topic. And then we come on to the kidney part, which is also called the acute post-strep glomerulonephritis. This basically is antibody mediated. So no toxin produced, it's post-strep. So after the whole shebang, you're left with antibodies which give injury to your kidneys. My God, those are more like lungs, but you get the idea, like bean-shaped kidneys. Okay, and it usually occurs about a week after group A infection. Now, the thing with this is it cannot be prevented with antibiotics. Antibiotics don't work here. Right. So those were the main diseases that are caused by strep pyogenes. Let's wrap it up here because it's already a pretty long video by our standards. So we'll get back to you with another interesting, amazing topic. If you have any comments, kindly write them down below. If you like the video, give it a thumbs up, and don't forget to subscribe to our video so that you get a notification every time we post a new video. And then thanks very much for tuning in. See you next time. Until then, stay smart.